Welcome to this presentation of Protecting Kittens from Feline Panleukopenia with Doctors Uri Donnett and Becky Stuntebeck. Becky joined the Koret Shelter Medicine program at the University of California, Davis as a facility design and outbreak veterinarian in 2022. She obtained her DVM degree at the University of Wisconsin, completed a shelter medicine internship at Dane County Humane Society, and a shelter medicine residency with the University of Wisconsin Shelter Medicine program, all culminating in board certification as one of only 36 specialists in shelter medicine today. In addition to facility design, her interests include shelter data, proactive population management, infectious disease prevention in shelters, and building relationships with folks across the sheltering field. Dr. Uri Donnett is the chief veterinarian at the Dane County Humane Society in Madison, Wisconsin. Uri was also board certified in shelter medicine. His interests include high quality, high volume spay-neuter, other shelter surgeries, transport programs, epidemiology, and infectious diseases in the shelter setting, as well as high-quality, low-cost medical care for rural and resource-scarce shelters and communities. Uri has served on the board of the Association of Shelter Veterinarians. Let's welcome them and learn more.
Thank you for that introduction. Here we go. We wanted to start by saying thank you to Maddie's Fund, who's obviously facilitating this discussion today and hopefully helping us to answer many of your questions. And also the Maddie's Million Pet Challenge. Dr. Levy already introduced the three of us that will be presenting and facilitating today.
Hey everyone, thanks for joining us. One thing we wanted to point out is that we created this presentation based on the questions that y'all have submitted. We really want this to be meaningful and easy to put into action right away. So that is where we're starting from. We're probably not going to have time for everything, but I also want to really encourage you to go on later to the Maddie's Pet Forum and look at the handouts we provided, because we only have time to scratch the surface. We've got good stuff here, but if you want more, start there and feel free to reach out to us in the future. So this is where we're going today, and we're going to spend as much time in that Q&A at the end as we can. But do note, you're very fortunate to have a group of veterinarians here today to answer questions, but we aren't going to be answering questions about specific cases that we aren't providing the care for. So it will talk about shelter cases in general, and that's how we're going to limit our time.
As was mentioned, why give this presentation now? And our hope is that this is really quite timely. So this is just one, many of y'all are in shelters that might be able to make similar graphs of what your kitten season looks like in your cat intakes. And what you can see is that kitten season and cat intake time really peaks during our summer months, June to November. And often that coincides with peaks of kitten intake. And kittens are our most susceptible population. And so with kittens, we definitely run the risk of seeing increases in panleukopenia in our shelters. And so we hope that this is very timely, given that we are in August, right in the middle of this map. And certainly why discuss this topic? It is really impactful for shelters and organizations that get in panleukopenia, right? It's infectious, it's contagious, and it can be quite devastating to an organization that's not prepared or doesn't know how to manage this. So we have to start with some background about the virus that is the cause of this disease. This isn't, the highlight maybe, but understanding the virus really does help us understand how we need to approach it. So it is a non-envelope virus, and it is a single-stranded DNA virus. So that does mean that it is environmentally persistent, which is part of the reason that it can cause infections in new cats and bee spread, because it does hang out in the environment both outside of our organizations and inside of our organizations. It's shed in many different body fluids, feces, oral fluids, urine, and things like that. And because it's a DNA virus, it is a pretty stable virus. So panleukopenia is panleukopenia. We don't see it mutating like we do some other viruses of concern. This is our epidemiologic triangle, which really describes how and why animals get infected and how it spreads within our organization. So we have our host factors. our pathogen factors, which we just discussed, and then our environmental factors. And we'll be covering all of these in some detail, but we're going to start by talking about the cats, the host factors. So who is generally at risk of infections? While we generally think of kittens, the reality is that it is any unvaccinated cat. And this is really important because when we're worried about this in our shelters, we take a lot of precautions and focus a lot of time and effort on our kittens, but we cannot forget the adult cats and leave them at risk. So any age animal can be affected if they are unvaccinated. We do think of juvenile 6 weeks to 6 months being most susceptible because they're still developing an immune system, and we may not be able to fully protect them with those vaccines. We have to look at the course of disease. So the virus has an incubation period of 2 to 14 days. So it's long. It's very similar to canine parvovirus. But the reality is that most animals that are going to get sick are going to show us clinical signs within 3 to 6 days of infection. So while they can show clinical signs up to 14 days, that's not typically what we see when we see this spreading. We see clinical signs earlier. They can shed the virus before they show clinical signs. So this is important because when we're trying to triage a situation and identify who's exposed and who's at risk of infection, they could be shedding virus and contaminating the environment before they're actually showing us clinical signs. And they can continue to shed virus up to 14 days after they no longer have clinical signs. So again, when we think about what to do with animals that have recovered, that's an important thing to keep in mind. So what does panleukopenia look like in an individual cat or kitten? Some of the struggles we all have with this disease is it can be really difficult to identify. With canine parvovirus, you probably think of the smell before anything else. And it sort of has more classic clinical signs. But with panleukopenia, a lot of the clinical signs are vague and could be clinical signs of a lot of different things. So this is a graph just showing one case series where they were reporting the clinical signs. And the most frequent clinical signs were fever, shock, anorexia, lethargy. They were not things like diarrhea. Diarrhea did not occur in most of the cases. And so it might just be a cat that is sitting in the corner hunched, that doesn't look right, that isn't eating. They may not be vomiting or having diarrhea. And so it can be really vague clinical signs. And it can be hard to identify this early. Decreases in appetite can be a great indicator if you're keeping track of appetites. But it's also really important to keep in mind that this could just be any cat or kitten that you find acutely dead or dying. Sometimes that is the first sign we have that panleukopenia is in our organization, right? That we come in and we find an animal that no one had noted clinical signs in before, dead. And so this is one of our #1 rule out. So if you find a dead animal, a dead cat or kitten, feline panleukopenia virus should really be at the top of your list when you're considering what could it be and how to handle that kitten, any other exposed animals to it, and the workup. So if we identify animals with clinical signs, how do we confirm that panleukopenia is the cause of those clinical signs? For our diagnostic testing, we have a couple of options. Generally, the easiest thing to do in your organization at the moment that you're noticing the animal will be a point of care fecal antigen test. Generally, this is the canine parvo test. It is labeled for dogs. It is not labeled for cats. The company did not validate it for cats, but there is lots of literature about its use in cats. You can use the canine parvo tests. You can swab feces or the rectum. You can also swab orally and then swab the rectum or feces or swab vomitus. Like I said earlier, the virus is shed in many bodily fluids. And so the more bodily fluids you swab, you may be increasing your ability to detect the virus. And generally, I don't work for any companies. I'm not selling any products here today. There are many different tests that you could have that are point of care tests. So you just want to make sure that the company tells you that your test is going to work the way that they say it will, and that the company is able to stand behind the test if you're having confusing results. This disease is called feline panleukopenia because it causes a panleukopenia. And so you could confirm a test result if the test result doesn't agree with what you think is going on with the cat, doing a CBC or a blood smear, a complete blood count, and look to see, what is the white count? Is it decreased? And then certainly there is PCR that you can send out for. This is going to be more expensive, but this is also going to be your most sensitive option. There was a paper that did come out a little bit ago that compared, in this case, the SNAP ELISA, just one of our point of care tests, to PCR. And they found that the SNAP ELISA should be viewed as an initial diagnostic test to rule out feline panleukopenia. And the recommendations that came from this paper were that if you identify a cat with clinical signs and you run the SNAP test and the test results are positive, you should assume that it's a true positive, that that cat does indeed have panleukopenia virus, and proceed accordingly. If you have negative test results, but the cat has clinical signs, the results are unreliable. A negative doesn't necessarily mean no panleuk. And that additional testing would be indicated. That could be the PCR, that could be a CBC, some other confirmatory test. It is important to note that we're talking about using these tests in the context of clinical signs. We're not talking about screening healthy cats or testing every cat on intake. These are not reliable screening tests, right? Because we don't quite know what a negative means, right? We feel confident with clinical signs in a positive test. We should handle that animal as infected, but we don't know what a negative test means. So these are not intended to be screening tests. So we get a positive in a cat with clinical signs, and we need to decide how to treat that animal and manage that case. And I think it's important to talk about what we can do and what we should do. There are lots of disease processes for which there are treatments. It does not always mean that we can treat the animal within our organization, whether it's a shelter or rescue, right? We have to operate within our capacity for care, and we have to identify as organizations what we're capable of. So treatment is not recommended on site unless the shelter or foster home or rescue has the ability to isolate affected animals and prevent spread to others, right? This is an infectious disease. And so if keeping the animal and treating the animal is going to be putting other animals at risk, it is not recommended that they be treated in that facility. Your agency must also have the resources to provide appropriate and timely treatment and monitoring of affected individuals in lines with accepted standards of veterinary care. So if you're not able to do that, again, looking for other outcomes or outlets for that animal in order to get them treatment or management. And there's a really nice resource here that this QR code goes to that is a treatment algorithm for the capacity of your organization for parvovirus in dogs. But if you substitute the word dog with the word cat, really you can use it. It's a decision-making algorithm. It doesn't talk about actual treatment, but it's really useful for going through and figuring out what is your capacity, what can you manage as an organization and do safely. I'm not going to go through this slide in detail, but if we are going to treat a sick cat within one of our organizations, they need to be isolated away from other cats. And this needs to be isolation for panleuk. This can't be putting panleuk cats in our upper respiratory isolation or ringworm isolation, for example, because they're different diseases. So this is isolation just for panleukopenia. We need to make sure we're cleaning our animals healthy to sick, or have separate staff that can care for these animals. Ideally, this would be away from other animals in order to make sure that we mentally recognize that this is a different group of animals and we don't screw up, right? We want to make it easy for our staff to do things the correct way. And so if you can separate them in a physically different space with all the PPE they need, they're going to be more successful in isolating those animals than if it's not clear where the infectious disease zone starts, right? But if you had to, you could isolate these animals within a ward with other animals by space and designating areas and having a clean, a contaminated, and an infectious zone. We need these cats to have separate supplies and equipment, keeping in mind too that we have a very resistant virus. So this may be disposable supplies and equipment that we're going to throw out at the end of our outbreak or treatment, and not to keep and try to sanitize. Disposable in this case may be very useful. We want to keep these cats away from hard to clean supplies like cat trees, large group cat housing, because we also want to be able to monitor them closely. So ideally this is individual cat housing, or if it's a litter of kittens, maybe 2 or 3 kittens, where we can really tell who's eating, who's having diarrhea, who's vomiting. We want to clean the cage without handling the animals as much as possible. And so using our spot cleaning and then thorough disinfection after, and of course wearing appropriate PPE. And for this disease, because it is so infectious and hardy, that is having ourselves anywhere we're coming into contact with the cats fully covered, and in things that we can take off, like gloves and gowns, and shoe covers if you're walking into a room and things like that. I don't have the specifics of treatment here, but we do have many resources for you in the folders that you have access to. The 3 killers of these cats are dehydration, sepsis from bacterial translocation, and hypoglycemia and hypothermia. And so, especially our kittens, right? And so we want to address their dehydration. In an ideal world, this is done with IVs or in very little kittens, intraosseous fluids, but this can certainly be done outpatient using sub-Q fluids. We would need to prevent sepsis, and so we're going to use broad spectrum antibiotics. And keep in mind, generally these cats are not eating, they may be vomiting. So in all of our treatment options, we are going to avoid oral routes, right? We don't want to make them more averse to food. We don't want to encourage more vomiting. And so we're looking for injectable antibiotics. So this could be your Convenia, this could be ampicillin. There are several different products that are broad spectrum and ideally longer lasting, so that we're also not giving these kittens lots and lots of injections and a lot of aversive handling. This can be very painful, right? They can have gas and bloating and GI distension. And so we can manage some of that GI pain with things like meropenem, but they may also, be indicated to have some buprenorphine or some other analgesics to help these kittens. If we treat pain, they may recover quicker from our infection. And then we really want to focus on early return to nutrition. So avoiding putting aversive things in their mouths so that they do start to eat, offering them highly palatable foods, using Karo syrup if we're worried about hyperglycemia and putting that on their gums, and then using our antiemetics and our appetite stimulants to encourage early return to eating. We really want to focus on aggressive supportive therapy and sort of avoid treatments that we don't know will work, and also avoid treatments that we can do them, but let's do them once they're on the mend, right? So ideally these kittens would all get dewormed, but let's wait till they're eating again, because most of our dewormers are oral. So we'd like to do that, but we'd like them to be eating and recovering before we start to deworm them. As far as the expected prognosis goes, there are lots of different reports with varying rates of survival. In older reports, there wasn't a lot of aggressive therapy done, and survival rates were very poor. And generally, if no treatment is performed at all, survival rates are going to be very poor. But with aggressive therapy, survival rates can be up in the 90s. If animals are going to pass away, it is generally early in illness. And they may be less likely to survive if their blood work is very, deranged, if their white blood cell count is very low because they can't, fight off infections, if they are very thin or malnourished to begin with before infection even started, if they have a very high fever or very lethargic. Animals that do recover, keep in mind, may shed the virus up to 14 days after recovery from their initial diagnosis. And so a general safe recommendation, if you were going to proceed with caution, would be to isolate them for 14 days from diagnosis. There is some thought that you can retest them with the SNAP test. And if they're not positive on the SNAP test, if they were positive to begin with on the SNAP test, because some of our cats are not, then that might indicate that they're not shedding infectious virus. But there was a study that looked at PCR results that showed that there was still virus present. Survivors cannot be reinfected with panleukopenia. So you don't need to rush to move them out of the ward, they're not going to get it again. But they could be spreading disease if you move them out too early, and they're still shedding infectious virus.
All right, so Uri took us through a lot of the information surrounding looking at an individual cat or kitten, and definitely get in your questions if there's something there that wasn't addressed. But now we're going to take it a few steps back and take a look at sort of the population level. So how might we start to recognize signs that we're experiencing an outbreak? So this is a graph from a real shelter, and they reached out for help because they were experiencing a panleukopenia outbreak. And let me orient you to the graph a little bit. Over here, the blue is intake per month. So the total number of cats that were coming in per month to their shelter. And then these colored columns represent the relative numbers of euthanasia, and the different colors represent different reasons that the cats or kittens were euthanized. The red is the reason for euthanasia was panleukopenia. So they knew they had an outbreak starting in September, and they reached out for help starting in September. But if you look at what was happening before September, they were euthanizing cats for failure to thrive, other, and they were also purple, finding cats or kittens who were dead. In the chat, go ahead and weigh in. Do you think that the outbreak started in September? Sure didn't. Nope, it didn't. So this is where having that pulse on trends over time and really maintaining the capacity to have a sense of what's happening across a population can be really valuable, because there were some early warning signs. We can't know exactly why the cats who died in February died. It may have been panleuk, it may have been something else, right? Sometimes itty bitty kittens pass away for a variety of reasons. Maybe these were adult cats. We don't know based just on this graph. But what we can see is that they had a lot of animals found dead. And that should have been a reason to start digging deeper and figuring out what was going on. And again, as Uri said, when you find an animal dead in care suddenly, your first rule out, the first thing you want to take off the table if you can, is panleukopenia. Because if you don't, you might be spreading it around. So then let's think about what an outbreak might look like by paying attention to some individual cases. So in shelter A, we have this cat named Spice. Spice came into the shelter. He's an adult cat. He was admitted October 7th. He seems healthy. He's a little quiet. On one day after he came in, he was vomiting and wasn't eating much. And then about 4 days after he came in, somebody decided to parvo test him, and his test was positive. So he has panleukopenia. The first day that he started showing signs, think about what Uri shared a little bit ago, was 1 day after intake. So we can use that timeline to assess where did he most likely pick up the infection. So be thinking about that. I bet you know the answer already. In shelter B, we have a different cat. We have Shugs. Shugs is an 8-week-old kitten. He was admitted on September 29th. He had URI, but otherwise seemed like a fairly friendly and otherwise healthy kitten. But then 13 days later, after having some clinical signs and eventually getting tested, his parvo test was also positive. So now we've got a cat with a 1-day time to clinical signs and a cat with 13 days to clinical signs. So again, when we look at these two cases, Spice came into a shelter with an infection that he acquired before he arrived to the shelter. He's still a risk to other cats in the population if we have lapses in biosecurity and have risk factors for transmission, but he didn't get it from us. Whereas Shugs clearly got it from us. He was in our care when he was infected with this virus. So we have potentially undetected until now transmission happening. And so we're going to respond to these in a different way, right? We want to make sure these guys get isolated and can't spread to new individuals. But in terms of thinking about where it's starting, Shugs, something was going on in the shelter before Shugs got it. Whereas Spice, there may not be any other animals that you have to worry about potentially. And I'll talk a bit more about what you'll do once you have an animal with panleukopenia, but that's an important differentiation here. So let's dive in. So we think we've got, oh, and one thing I didn't say explicitly there, and I just want to point out, because we are talking about an outbreak and my examples were only 1 cat each. Technically, we're going to call an outbreak any number of cases above what is considered normal is an outbreak, okay? In this case, Spice, the cat who had just arrived when he was sick, his outbreak doesn't necessarily need to get pushed any further into the population, right? It can stop with him. But the normal number of panleukopenia cases to have in your shelter is 0. It's going to happen, but we can still call it an outbreak when it happens. We don't need to have X number of animals or X percentage. So once we think we have an outbreak of some kind happening, what should we do about it? And the emphasis here is really going to be thinking about those shelter-acquired outbreaks. We have evidence that animals are getting infected in our care. So a lot of words here, don't get hung up on that, but these are sort of a lot of the steps that we want to make sure we're taking care of as we respond to an outbreak. I'm not going to go through all of them today, but this textbook and other shelter medicine textbooks have some really great detailed information if this is something you really want to nail down. And there's other resources through Maddie's University as well on specifically working through a panleukopenia outbreak if you don't get enough of what you're looking for today. So as we're thinking about managing an outbreak, we want to think about who is exposed. And in order to think about who is actually exposed in our population, again, we're thinking more about Shugs at this point. He got panleukopenia while in our care. How does this virus move from one cat to another in a shelter environment or a foster environment, potentially? So think about, there's supposed to be a little video here. So unfortunately, this person's hands, this human hands, are covered in clay, but it just happened to be brown and looked like poo, so I apologize. But potentially a helpful visual, right? So we become contaminated on the surfaces of us that come in contact with the animal who might be contaminated or with the objects in the animal's environment that become contaminated. And you can think about this like wet paint or wet clay on someone's hands, right? In terms of where it's going to go once it's out of the individual animal. And so it's spread by direct contact between individuals. They're shedding it in any body secretion, poo, saliva. So licking each other could be a way to transmit theoretically, but also contaminated surfaces because this is a hardy virus and we're calling those fomites. So think about that wet paint as we're going through. So who really is exposed in an outbreak situation, right? You might have a shelter, you might have 100 cats in your shelter. Hopefully you don't have 100 in your foster home, but okay, we're talking about a population of 100 cats, wherever we are. Is everybody exposed? Maybe. But let's start to really drill down to decide if we really need to consider all 100 cats exposed. So if this kitten had panleukopenia, how could it move to potentially infect this cat? We're not letting them interact together. They're staying in their cages. So in this case, it's got to be a fomite transmission. A fomite is moving panleukopenia from one cage to the other. And there's some animations that don't seem to be working here. But if I tell you that this kitten has panleukopenia, but at this shelter, every cat has their own litter scoop, and there's really good use of PPE and whatnot, the risk that this cat is also exposed now might be lower compared to a shelter where their protocol is sharing litter scoops between cats, and in this bucket is an unmeasured bleach solution. Okay, so this is a pretty high risk factor. This situation is probably moving panleukopenia from one cage to another very easily compared to this, right? So the exposure risk here is a little bit different. I can't tell you exactly what it is because it depends on a lot of different factors. And these are things we start to think through when we realize we've got an outbreak going on. So our sanitation protocols and practices our use of PPE and hand washing routinely in the course of doing our day-to-day work. How full are we right now? Are we crowded? Are the animals stressed? Do we have enough staff to spend time and notice when animals aren't feeling good? What are our vaccination protocols? Is everybody getting vaccinated at intake? And so on and so on. There's a lot of factors at play here that are going to affect who is likely to have meaningful exposure and who isn't. And that's going to vary from one situation to another. So these are questions you need to explore if you're facing an outbreak. Let's talk about foster home. So again, remember our wet paint here. So imagine we have this is my home. I'm a foster home, and I've got 2 different litters of kittens in my foster home, and they're at the farthest possible reaches of my home. One's upstairs, one end of the house, other's downstairs, the other end of the house. Okay, so if this group breaks with panleukopenia, how is the virus going to get from them to them? Think about wet paint. It's if I happen to get the paint, the virus on me, and I move it to these kittens, right? That's how we spread it. So if biosecurity, if we're not confident in our biosecurity practices, again, shelter or foster home environment, then we need to consider this group exposed. And we'll talk about what we do if we think someone is exposed in a little bit here. But now also, because we've talked about how hardy this virus can be in the environment, if the virus then does infect this group of kittens, these kittens have left, or this original group, they left to get treatment in a hospital. These kittens have become infected. We bring in a new group of kittens, but because the virus is hardy, not only could we potentially spread it from this group to this group, wet paint, via me, the caretaker, we also have the environment that we need to worry about. And I think most of you are very cognizant of that because we've gotten a lot of questions about foster home cleaning and how long to leave a foster home open. And we're going to hope to address that. If not in the presentation here, I see you can't see my cursor, I apologize. I don't know that I can change that because I am not the one screen sharing, but I'll try to be clear in my descriptions going forward. We're going to talk about what does it mean to make sure we're getting as much of the virus that might be remaining in the environment out as possible. But in the meantime, let's talk about how we mitigate risks in foster. So biosecurity of the caretaker and care supplies, right? If you're moving feeding equipment or cleaning equipment from one group of foster animals to another, you are moving fomites around in general, and that's a risk. We also put kittens at risk if we decide to mix kittens from different litters. And this can look like a variety of different things, right? We could get a solo bottle baby and we have another solo bottle baby and we want to put them together for socialization purposes. We might have a litter of 3 kittens over here and a litter of 2 kittens over here, and it's just easier if we care for them all in one room, right? There's a variety of reasons people might consider mixing kittens, but we really want you to proceed with caution and intentionality if you're going to consider it. So for kittens who are going to stay somewhere for a very short time, whether that is a shelter environment, a foster home environment, it's probably not worth the risk. Your best bet is to continue to keep that stay as short as possible and have as good of biosecurity as you can and protect them from exposure and keep them moving on their way. If a stay is longer for some reason, those neonates who are still nursing and need that time to grow and get socialized, you are taking a risk if you are going to mix kittens. But of course, we're balancing the risks from infectious disease and other medical issues with the concerns that we have for them becoming well-socialized, reasonably well-behaved animals as they grow. And so there's times where you were going to perform that risk assessment and it's going to come out in the favor of putting 2 different units together. You reduce the risks if everybody looks healthy when you're putting them together, and you reduce the risks if somebody has been in a low-risk environment for 10 or more days and continued to remain healthy. Now, one of the handouts we've provided includes a link to a Raising Bottle Babies guidebook, and that has a really good detailed discussion around considerations for mixing kittens. So definitely check that out if that's something that you're feeling pressured to think about in the operations of your day-to-day work in caring for kittens. So when we're talking about the foster home environment specifically, we want to think about, well, how many litters can we put in any single foster home? And by litters, that could be a litter of 1, or it could be a litter of 5, whatever. But separate units, how many can be in any single home before that foster caregiver can't manage safe biosecurity practices, can't manage not becoming a fomite that's moving that wet paint from one place to another. And also that foster caregiver's ability to monitor the well-being of the kittens from one day to the next. If they're so busy moving from room to room to get the feeding done and the weighing done and the everything done, they may be missing out on those early signs that something is amiss and missing out on an opportunity to isolate, get somebody assessed, and potentially get somebody treated and out of that environment where they're not putting other animals at risk. We're going to talk about decontamination of that foster home in just a moment. So this QR code, don't worry about taking a picture now. You'll have access to these slides later, but this will take you to that guidebook and that discussion of mixing kittens. But it really helps you weigh those risks carefully as you proceed with making those decisions. Okay, so once we've started to think about, well, how many of the cats in our population have meaningful exposure? If they were exposed, who's really at risk for getting sick? Because it's not equal across different individual animals. And so we can use a variety of questions or criteria to sort our population into risk categories of high risk. If I am exposed to the virus, I am at high risk for getting infected and becoming severely ill, versus low risk. If I get exposed, I am at low risk for getting infected. So we go back and we look at records and look at who's been where relative to how long we think this outbreak might have been happening. And there's a lot that goes into that, but please, you can dig into our handouts for more details on that. And this chart is also in one of those handouts, so I'm not going to spend time here, but examples. So we've got our exposed population. Who is sick? Yes or no, are you sick? What is your age? This category, and you go down the flow chart and you can group animals into high versus low risk situations. And what we tend to do when we've done that thoroughly is let those low risk individuals move on so that we can make some space to focus on the high risk animals and start to continue to sort through quarantine situations, how we're going to change shelter operations as we're in the midst of managing this outbreak and whatnot. So lots of opportunities to start to make useful decisions and start to resolve the outbreak situation through that. So once we've labeled an individual as a high-risk individual, we've got a few different options. And on here, I have business as usual, but that's just crossed off. If you're all here, you don't want to do business as usual, I hope. Vaccinate. So we'll either talk about vaccinations a little bit more in Q&A, but I also have some really good information in the handouts for you, including a really cool video that I put together. But when you have evidence of transmission happening in your care, even if you think an animal is up to date, if anybody who hasn't been vaccinated in the past 2 weeks, just go ahead and get those vaccinations redone, because it's not going to hurt anybody and it may help. So that's one layer of protection. Depopulation. The problem with depopulation is you may nip the current outbreak situation in the bud, but unless you correct all of the risks, factors, and the operational practices that set up that situation in the first place, it's all going to happen all over again. We don't advocate for depopulation just because, well, not only because we don't want to see all those animals' lives lost, but because it's actually not a useful tool to keeping it from continuing to happen over and over and over again. Quarantine periods can be used judiciously, and we'll talk a little bit more about that. And the other tool to be aware of is titer testing, and that's where we measure antibody levels in individuals. And anybody who's got a protective titer, even if they were previously labeled high risk, a protective titer is protective, send them on their way, move them on. They don't have to be in that high risk category anymore, and you can focus in on the remaining high risk individuals. The problem with quarantine periods is that anytime exposure happens again in the midst of that quarantine period, you have to reset the clock. So we use typically an incubation period as our quarantine period, which Uri talked about is going to be about 14 days. You can usually get away with 10 to 14 days. So you can pick 14 days quarantine and you're going to watch those high-risk individuals. But if any of them break with panleukopenia and you're not confident you contained it to that individual animal and there's potential exposure, you got to restart the quarantine each time potential exposure has happened for the rest of the animals. So it also ends up potentially being a really challenging tool to really help you get out of an outbreak in a timely manner. Okay, so let's talk a little bit about decontamination of the environment in an outbreak context. It's really about sanitation, and going to talk a little bit more about sanitation a little bit further down in the presentation. So stick with me. But let's think about in any environment, how long our wet paint, how long is our virus going to last in the environment? We know it's hardy. And so we also know from some published research that it can stick around for several months to potentially multiple years. But that's if you don't remove it. Okay, so I think it's a cool analogy here. So let's say we just baked the most amazing, delicious chocolate chip cookies, fresh out of the oven, about to take a bite, and it sort of goos and crumbles to the floor. And because you're in my house when this happens, there's cat hair all over the floor, okay? It's just the reality of my life. The cat hair is like panleukopenia virus. So if you let the cat hair stay there, it will stay there. But if you work to remove the cat hair in all the ways you would approach removing cat hair, your cookie will not be contaminated if it falls on the floor if you removed the cat hair. So the cat hair will be there unless you get rid of it. It's the same thing with our virus. So we're going to go into details about how you can get it out and feel good about that you're getting it out of the environment. But I want you to know that you can. Just because we say it's a hardy virus doesn't mean that you need to worry about getting rid of it. It is doable. It is achievable. So in terms of environmental decontamination, if you have evidence of in-shelter transmission, you want to look at your current practices. Are people following protocols? Is the protocol doing what it needs to do? What went wrong? Is that contributing to the transmission in the shelter? Once you have an effective protocol that you are confident is being used, using it once on a contaminated surface or object is sufficient. So we get a lot of questions about, well, how long do we leave a cage empty? How many times do we clean it? We don't get to know usually, but what we can do is trust a really good process. So if it is done well, it will work the first time, and you don't need to do it multiple times. You can for peace of mind, but there's really very little value to be gained by keeping a cage empty for any period of time. Other than potentially, it might mean one fewer animal in the population, which gives the staff a little more breathing room to focus on the other animals. But from a contamination perspective, holding that cage open for a year or something like that, it's just not practical. And one particular call out in addition to all of that, if your disinfectant is a quaternary ammonium compound, often referred to as quats, it is not trustworthy when it comes to eliminating the parvovirus. So we want to use something that's effective, and there are many effective options. Accelerated hydrogen peroxide products, bleach solution, a variety of others, all with their pluses and minuses. So there's decisions to be made on which is the right one for you. But if you are relying on a quat to be your disinfectant, you need to switch immediately. The final aspect of outbreak management that I'm going to spend time on during the presentation here is talking about a clean break. So a clean break is where we make sure that if we remain open to new admissions, and this is largely going to be focused on that shelter context, right? We want to be available to our community, and animals in need may need to come into the shelter, but we don't want to add fuel to the fire if the outbreak isn't resolved. So we need to put in operational practices that are going to ensure that any newly admitted animals will not be exposed to anything that has already been happening in the shelter. And that is the idea of the clean break. All right, we are going to dive now into prevention. So we talked about this a little bit ago. We talked about how the individual animal who's getting infected, a lot of factors about that individual are going to affect how sick they get, if their risk of death and whatnot. But now that we're going to focus in a little bit on the environmental factors that are relevant to our shelter setting. So how many other animals are in the environment around someone? Are they stressed? We are going to talk a little bit more about sanitation, and then we're going to talk about the housing that we decide to provide for them while they're in our care. Not going to read through this. This is from that infectious disease textbook, but we know if you take care of kittens, you're going to have cases of Panleuk. Spice, our orange guy earlier, he got Panleuk from wherever he was in the community before arriving in the shelter. So have a plan before it strikes, before you're feeling scared, panicking, and trying to deal with the outbreak. Have a plan in place that's going to help you work through it. We do not recommend that shelters utilize routine automatic intake quarantines for cats or kittens. What it ultimately does is it prolongs their length of stay in care, and any time spent in a high-risk environment is time where they have potential to be exposed. It makes it more likely that you are going to give a cat an infectious disease if you hold them without good cause for an automatic intake quarantine. So instead, you want to take a look at what they look like at intake, train your team, and you're going to look for signs that they're not healthy at intake, and you're going to keep looking at them every single day. And you're going to find the evidence if somebody's not looking good as early as possible that way, instead of automatically quarantining them and waiting to see if something bad's going to happen. So these are the five big pillars we're going to focus on today in terms of prevention. And I'll hand it back over to Uri now.
All right. So you now have heard what panleukopenia does to a cat and the impact an outbreak can have. So obviously what we'd like to do is prevent it. And one of the key ways we can do that is with our vaccination. And so everyone should be vaccinated on intake to an organization, whether that organization is a foster-based, rescue-based organization or a shelter. If they should either come in with vaccine records that show that they're up to date or be vaccinated. There should not be exceptions. We want ideally for this to happen before they enter the high-risk environment. But at least at the time that they enter the environment, it should be an injectable vaccine and it should be a modified live vaccine. And we're talking about the FVRCP specifically, because that is the vaccine that contains the P, which is Panleuk. If the cat is over 5 months of age, then a single vaccine that is injectable and modified live should be sufficient to provide protection as long as the cat is able to respond to the vaccine. So a single vaccine in a cat over 5 months of age should be sufficient, but they could receive a revaccination in 2 to 4 weeks. But for our younger cats, then the question becomes, how many do they need? And so ideally, again, they need one vaccine given at the correct time. The problem is that we can't guess when that time is and whether or not they had maternal antibodies. So if mom had panleukopenia or was vaccinated for it, she may have passed some protection to her kittens. And it takes time for that to go away. And it's sort of indeterminate when that can happen. And it is kitten by kitten. And so since we can't predict that, we know it can happen anytime from day 0 to up to 4 to 5 months of age. For that to go away, they may never have any protective antibodies from mom, or they may have very good protective antibodies that take a long time to go away. And so we want to start vaccinating at intake and then revaccinating every 2 weeks until we hit 20 weeks, at which point really those maternal antibodies should be out of the picture. And so the recommendations are to start at 4 weeks of age. And we'll revisit this a little bit later. Revaccinate in 2 weeks if they're still in shelter care. So we're not holding cats back for vaccines either. We're not telling adopters they can't have a 6-week-old kitten because it needs another vaccine. Let adopters take the cat to their veterinarian and continue care. But if they're still in our care, we're revaccinating every 2 weeks until 20 weeks of age or adopted. And there are additional resources specifically about vaccination. What about transport? So what if you are taking in cats or sending cats out? What is the minimum number of vaccines that a kitten should receive before they get sent somewhere? And ideally, they still have gotten vaccinated on intake and they are getting vaccinated every 2 weeks. But if a transport is scheduled, there is no reason to hold a cat back for vaccination instead of sending it on transport. Again, we're keeping them in a high-risk environment and potentially exposing them to pathogens while waiting to send them someplace else instead of getting them to that next destination so that they can get to an outcome. It does require communication and planning, and if you are in the transport business, you should be operating with MOUs of agreement where organizations know what kind of care the cats are receiving before they're transported, and you know what kind of care they're going to receive after. But we shouldn't be stashing kittens in a shelter waiting for additional vaccines when they have somewhere that they can go and they have an outcome they can have. Back to you, Becky.
All right, so a little more detail on sanitation. And in this case, we're talking about using it preventatively. But again, all of the principles, prevention versus in the midst of an outbreak, are going to be the same principles. So when you're in an outbreak, you might be feeling stressed, but in general, think about what surfaces are likely to be contaminated if Panleuk were to be there and pose a risk to other animals. So we don't end up with Panleuk on our ceiling, and even if somehow we did, no cats are coming in contact with that ceiling surface, right? So we don't need to worry about going after the ceiling when it comes to Panleuk in general. If there's dust bunnies up there or something, feel free to have at it. But when we have surfaces that are in contact with animals, high contact with animals, or high contact with their home environment, their cage, their room, etc., their blankets, we want to do a really thorough multi-step process, and every step in this process matters. A lot of people tend to think about disinfectant as the key, but it is one of the final steps, and you've hopefully already removed most of the virus with previous steps before you're even applying disinfectant, and that optimizes how well your disinfectant is going to get rid of anything that's left. So the first step is to remove gross debris. If there's poop, litter, fur clumps, etc., get rid of those. Those are all going to get in the way of your cleaning products being effective, right? Next step is cleaning everything with detergent so that it looks like it's been cleaned. At that point, if someone didn't know how much of the cleaning process had been done, they might think it was done. So you're scrubbing well to make a visibly clean surface. From there, you get to apply your disinfectant, and you want to make sure, again, you're using a product that's effective, and you're going to want to make sure you're diluting it, you're measuring it, and using an appropriate dilution, and you're using it for an appropriate contact time. All of these factors affect how well your disinfectant is going to work when in the face of infectious diseases that we want to get rid of. And then last but not least, this drying step, even for Panleukopenia, which is considered a hardy virus, it actually lasts longer in the environment when it's moist and cool. So drying also helps get rid of any virus that's potentially remaining after all of these steps. So every step matters. Now, when you have something, an object that you're not willing to throw away or something that you feel you cannot do every step well, do as much as possible or start fresh, throw it away, don't use it, etc. Those are your options. And when it comes to foster homes, we have more risk of having those scenarios if they were using a room with carpeting, if the kitten spent time on a couch. So going back to what I talked about earlier, we're not really going to focus on a set period of time where we can be confident that if we don't let somebody have kittens for a certain amount of time, that any kittens after that time period are going to be safe, okay? Instead, we're going to focus on doing as much of a good sanitation process as we can, and we're going to support the foster parent in doing that to the extent that's possible. We don't have good evidence for me to tell you how long parvo is going to last in fabric, carpet, and so on, some of the surfaces that we're more likely to encounter in the home. Again, just do your best. When you're selecting a disinfectant, some disinfectants are going to work better in the face of organic material, and a classic example of that is a product based on accelerated hydrogen peroxide as compared to a bleach solution. Bleach can work against parvovirus, but it's highly likely to be inactivated in the presence of dirt. And so it's going to work better. Accelerated hydrogen peroxide is going to potentially work better, more easily, and it's a lot less likely to do something like bleach everything and make the foster parent unhappy about that issue. And then again, provide as much support for the foster parents as you can. If you can cover the costs of a deep carpet cleaning with steaming and drying and maybe using a rescue accelerated hydrogen peroxide in the process of that carpet cleaning, that's helping to ensure that you're doing the best you can. Give them information, provide supplies, anything you can do to support them in that. That's probably going to be your better bet than leaving that foster home open for as long as for any period of time. You need that foster home, I'm guessing. And if it means you're going to end up crowding more kittens into other foster homes because this one isn't available, that's really something you've got to consider carefully. Consider the risks of sending kittens to that foster home after you've done the best cleaning possible versus leaving them in a high-risk environment, the shelter or an overcrowded foster home. And also, now, before things happen or even after they happen, remind folks to keep those kittens in spaces that can be readily cleaned. A bathroom is much easier to clean compared to a spare bedroom that has carpeting, for example, and all the bedding and all those complicated things. Back to you, Ori.
All right, so then we have monitoring. It delays advancing when we switch. So what we want to do is we want to identify an animal's needs at intake and then continue to monitor them for new needs every day. And so the way we identify cats that need things is we look for it. So first we're going to start by screening everyone at intake. And this is ideally you do this at the same time as your vaccination, right? So this is when we give all of our preventive care, we're identifying whether cats appear healthy or have issues that need addressed, whether it's to be taken somewhere for vet care, to be flagged for vet care in the facility, to be transferred, whatever that may be. But we provide our preventive care. We do our assessment of the animal. This doesn't have to be a veterinary assessment. This can be trained staff. And in theory, if we have protocols set up with vet approval, we can start treatment or isolate or flag sick cats. And again, prevent them from entering the general population and prevent the spread from the moment of intake.
All right, so let's talk a little bit about housing, and this is more relevant probably to those shelter environments and population management. All right, so housing, with regard to housing, if we're talking about cage housing, which is ideal for kittens or high-risk individuals who we want to leave the shelter quickly in general, so we can minimize their exposure and have a surface that's easier to clean up, an environment that's easier to clean when we're done. If you are currently using single compartment caging, that's providing a whole spectrum of risk factors for panleukopenia and other infectious diseases. So we really, 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 really want everyone moving toward providing double compartment cage housing when you're using cage housing. So there's a whole lot of reasons why it's better, but when we use this type of housing compared to single compartments, the cats feel better. And when they feel better emotionally and mentally, they also do better health-wise. They're less at risk from certain infectious diseases. It's a lot easier to clean a double compartment housing unit well when it's occupied. Our staff will become less likely to turn themselves into fomites because they're having less contact with an individual cat during daily care tasks. And when we use double compartment housing, it tends to create this positive cycle where animals will move through the system faster because we have fewer of them in care, because we have fewer cages, because every cat's getting what used to be 2 cages. They move faster. When they move faster, your daily population is lower, and all the risk factors that come with having more cats in a population at one time are reduced as you reduce the size of the population, and that cycle feeds itself in a really beautiful way. And then when it comes to population management, we're thinking about capacity for care. And this is actually that same shelter that I showed the graph of earlier that was experiencing a panleukopenia outbreak. The time is on our x-axis here, but over time, the purple is the number of cats that they had in care on any given day. And then the orange line is what I calculated as the maximum number of housing units that they should need if they were able to move animals through efficiently in the time period that we recommend shelters try to move animals through. And the blue line is what they were on average, their daily census on average, which was above their recommended maximum. And so this shelter, with some exceptions during that quiet season for cats, this shelter was routinely operating well beyond their capacity for care, and that is part of what set up the situation for this outbreak in the first place, and the outbreak to continue undetected for so long. So population management, whether we're talking about a shelter environment or a foster home, is really important. And I wanted to share this quote, and you can find this manual online yourself if it's of interest to you, but a lot of good stuff here, but in particular I wanted to read, "It is easy to get overwhelmed by taking in too many kittens, which could lead to disease outbreaks that could threaten the lives of many kittens in the nursery." So they're talking about kitten nursery settings in a shelter environment, but really emphasizing how it can be really hard to set boundaries on how many animals you're going to have in your care at any given time, but it's essential if we're going to do right by them. And that takes us to where I hand it over to Dr. Levy.
Thank you. This has just been so helpful and practical, and I can see from the chat and from the questions that people are really absorbing it and thinking more about how this applies to their own organization. But one of the things we really need to think about is how can we avoid putting kittens and cats in these high-risk situations in the first place, especially shelters or crowded rescue groups. And we know that shelters, especially this time of year, and these post-pandemic years, have been really stressed with high populations. So we can divert a lot of intake into better outcomes than shelters. And I'd like to point people to our concept of this cat superhighway to make decision-making more quick and easy and consistent when we are dealing with cats. And I don't think if someone could advance that, I don't think I have that. So this is a link that will take you to our community cat superhighway concept. If you've heard about this before, please just say hi in the chat. We're interested in how much uptake and information is spreading out there. We've been talking about it a lot this year. It's really working for the shelters and rescues that are adopting it. But when we're talking about free roaming cats in particular, so you find kittens or you find adult cats, we believe that there are 2 main superhighways that cats should be on depending on their age. So in general, if we find an adult cat that is thriving in the environment where it is, regardless of its temperament, we take that as an indication that it has people looking after it, and maybe even more than one household taking care of this cat as they make their rounds. And they are very likely to be in the neighborhood where they belong, and they should be neutered and vaccinated and returned. And I see some hearts going up, so that makes me happy too. So return to field or TNR for most of the cats that are found to be thriving in their environment. Now for kittens, we know they have a very high mortality rate. 50% to 75% of kittens in the wild will not make it to adulthood. And so for kittens that are not part of the ecosystem yet in a neighborhood, we want to channel them towards a home where they can have a nice, healthy indoor life, and they are probably still socializable at that age. And so we should be channeling all kittens to the superhighway for adoption, but not through the shelter. This is the key thing. Putting kittens in a shelter or an overcrowded foster home is really putting them at very high risk. So we have a website here that you can go to. We don't have time to get into it now, but about a kitten shelter diversion program that has been developed by our local TNR program that diverted 1,200 kittens last year into homes that would have gone to the shelter instead. So please go to this link and think about when you're encountering all of the cats that are out there outside and need help, putting them on a superhighway. Now, does that mean there's only 2 options for cats? No, it does not. We know that there are cats that are lost, abandoned, are not thriving in the environment, and they need help. And if we keep our shelters population down long enough, they will have the assets they need to take care of those cats that do need to go into a shelter. So we have off-ramps, we call them, small traffic off-ramps for those cats that really need to get off of the superhighway and into individualized care. So it might be going to the shelter in one case, or another common outcome would be a working cat program if they're not suitable for adoption, but they can't go back to their original location. We don't know where it is, or it's been destroyed, or something like that. So the superhighway, adults get neutered and returned, kittens get channeled to a home, but not through a shelter, and then little off-ramps for all the exceptions. And we will have hopefully a series of webinars on the cat superhighway that you can be watching for as well. What's next? Okay, so this is our rules of the road. Just to remind you, this is on that website where we have the QR code. Again, to reiterate, healthy cats go back to the neighborhood, kittens go into a kitten shelter diversion program, heading for adoption. If there is no place to return to, they can be channeled to relocation through a working cat program. That should be a very small number of cats. And then if they're not thriving outdoors, of course, they end up in a shelter where they can be helped.
So we are done. A little less time for Q&A than we were aiming for, but hopefully you've still gotten some really good information. And any questions we haven't answered, get those in the Q&A because we'll definitely get to them in the discussion forum. But let's see, there should be a really
cute... I did mark some questions that I thought were insightful and commonly asked. A quick one I can answer that came up a lot is, does FBRCP vaccination interfere with SNAP or PCR testing? Sometimes you get a positive in recently vaccinated cats, and if you are vaccinating every 2 weeks like we want you to, they are always recently vaccinated. So the answer is, with a SNAP test, it's very uncommon to have a positive after a vaccination. If it does occur, rarely on the IDEX SNAP test, it would be very faint positive. With some other tests, we've had some more positives. If you are submitting PCR, you definitely can be confounded by vaccination. So just keep that in mind. But in my opinion, if you are testing a sick cat and it's got any color on that dot, I would be very, very worried about it being Panleuk, and I would manage it as such. And I see our speakers agreeing with that.
Yes.
There was a case I really wanted to have our speakers address because there are so many red flags in it, and this is a very common situation. I'll read it from April King. I have a question about vaccinating the high-risk kittens born or more often abandoned outside. When rescued, they go into homes caring for 20 to 40 kittens at a time and die in similar numbers. Our vet insists that the traditional vaccine schedule beginning at 8 weeks with a follow-up at 30 days is the only approved schedule. Are there studies to show the safety and efficacy of a schedule? And then in some subsequent comments, she also said her vet is demanding literature on this. So take this on because this is not uncommon.
Yes. Uri, do you want to run with it? Otherwise, I'm happy to.
I'm trying to think of the literature. So I believe there will be references in both the ASV guidelines for standards of care to support a change in vaccines from general practice guidelines. I also think that both AHA and the AAFP vaccine guidelines address shelter and high-risk cat care and have a different vaccine schedule there than is recommended in general practice to like individually owned cats in low-risk settings. And all of those are guidelines that are free and open access, that your veterinarian can be directed to.
Yeah, and I think the other thing I'll end on is just vaccines are very safe, very, very, very safe, and the disease is not. And when we're moving kittens from high-risk environments, and in that scenario, I don't know the situation that it came from, but going into a foster home with that many other kittens, that's another high-risk environment. Get those vaccines in as early as you can and as often as you can, because it's not going to hurt the kitten, and it might help. It's going to help at some point.
Another question that came up that I can address is, what about using the canine parvo monoclonal antibody from Elanco in kittens? Will it work? And it's not labeled for use in kittens. It's being very successful in shelters, being used in puppies and adult dogs, but it can be pretty spendy because it's each vial only treats 10 pounds, and some of the bigger dogs can use several vials at $200 a piece. However, for kittens, it could be a very affordable treatment. There is no literature yet on its use for cats, but there are some anecdotal reports. Shelter vets are always the first to try this. So some of them have used the canine monoclonal antibody at the same dose as used for puppies, but giving it sub-Q. And they haven't treated enough to really know whether it's helpful. There is some research that's not been published that does show it to be safe for use in kittens. And there is a rationale for why scientifically it would work in kittens as well as in dogs, although possibly not as well. But I have heard people say because it's a canonized monoclonal antibody, it cannot work in cats, and that is not true. So we are all very interested in seeing studies or doing the work to evaluate this in kittens, because it could be very, very affordable. And especially you think of it's designed as a treatment, but wouldn't it be great if we had a preventive for the rest of the litter that's not sick yet? And that might be where this antibody is most useful.
I'll just briefly address this one. Someone asked about if you vaccinate a kitten who's already infected. Nothing. The kitten is infected, so they're going to get whatever disease they're going to get. The vaccine isn't going to help. It isn't going to hurt. So we probably do vaccinate animals who are already infected from time to time. No difference.
Here's another good question from a shelter vet. So for organizations and individuals that are operating outside of their capacity or providing below care standards in terms of providing appropriate isolation, how would you approach these conversations and manage expectations?
That's really tough. I feel for you. You know, that's a very hard place to be, to have conversations. Obviously, you want your work to be life-saving. But I think sometimes starting with protocols and saying, like, what can we do and what can't we do and how can we do it? And having it written down so that you have something to come back to and say, like, we are operating outside of this protocol and we cannot do this, right? And it's sometimes easier to get groups of leadership to agree on a protocol instead of on an individual animal, right? If an animal is in front of you, the urge is going to be to make an exception for that animal. It's more engaging, it's more involving. But to sit down, and now is not the season necessarily to write those protocols, right? Because we're all in the thick of it. But to know that when things quiet down a little bit, if this happened to you this year, you need to prioritize when you have some quiet time to preventing it in the future. And the best way to prevent it is to manage our populations appropriately, right? It's not necessarily to individually attack Panleuk, but it is really to focus on what are the flaws in our population management as an organization and what changes do we need to make as an organization.
And I would add that sometimes if you are the vet, or you are the local expert, your opinion won't be valued as high as an outside expert coming in. And so this is where you can contact the shelter medicine programs. I also put some links to the ASPCA has a shelter medicine program with experts that will do shelter consultations. And sometimes they will say the exact same thing as your local expert, but it will resonate more when an outsider comes in. So if you are, I would say any shelter that's really struggling with being over their capacity, which is maybe most shelters right now. And these foster homes, like the one that had 40 kittens in it and then lots of deaths, you've got to get that under control. There's no amount of vaccination and cleaning that is going to keep Panleuk at bay when they're so over capacity. And again, the shelter medicine programs and especially ASPCA right now can offer those consultations to help you rein in the chaos.
And so many people attended today, and I think that you should all take away from that that you're also not alone in this. It is the season. We are all seeing lots of kittens, and we will see Panleuk. And so whether you're a vet managing this or staff managing this or leadership, like, you are not alone. Your organization is not alone in your community and nationwide as well.
We have gone over our time, and thank you for being with us. We will continue a very vibrant conversation on Maddie's Pet Forum. We'll answer all of the rest of the questions that we didn't get to, and you can bring up more, and we can help you work through any problems that you're having now, or hear from your success stories. I saw some of those posted too, and those are really very inspiring that it can be done.
Thank you all for being here.
Thank you for joining us.